The Indian Ocean tsunami killed nearly 250,000 people and left another million homeless, and a whole population overwhelmed by confusion and grief. And I have been asked to tell the story of my experience as a doctor working in Aceh, Indonesia, the site most affected by the disaster. This video focuses on the work I did amongst the survivors, including some poignant stories from the patients I looked after. And again, I need to warn you in advance that some of the images and the stories might be emotionally confronting. Anyway, after taking a flight in through the mountains, I arrived at a town called Mulabo, the place closest to the epicenter. The general level of destruction and flattening of thousands of buildings was hard to absorb, honestly. The first ruined house I saw close up, there's one of the 140,000 homes destroyed in Aceh by the tsunami. It affected me more deeply than I expected. I stopped and looked at it, and when I saw the clothes lying around and a kid's bicycle and a kettle, it was impossible to imagine what was happening when the tsunami hit. Kids playing, a family laughing as they breakfasted. Then, honestly, imagining the catastrophic destructive wave hitting them. You very quickly realise that the 1 million survivors had a lot to deal with. That perpetual visual signal of massive destruction of family homes meant that the sense of tragedy and suffering pervaded most activities. It's hard even now to comprehend the depths of sadness, fear and confusion felt by the survivors. I mean, how would you imagine you would feel? Bodies lying around in piles and thousands floating dead in the sea. Existing medical services had collapsed. 517 health centres were destroyed by the tsunami, and many nurses and doctors, health workers were killed. The hospital capacity was, of course, very limited because of the tsunami flooding damage, so the team set up a triage tent at the main door, and we were flooded with patients, around 350 patients a day. I started work immediately I got there, and my rapidly acquired Indonesian skills were immediately tested. But fortunately, I had some bright young Indonesian doctors on either side if I needed a medical phrase. This consulting space was quite different to the usual ones I deal with in Australia. They don't care about confidentiality particularly. Consulting was a community effort. All patients and the attending family could hear each other explain their symptoms, and sometimes the family members would step in to translate for patients in the next line who only spoke Achenese, and therefore they were translating it into Indonesian. And also the doctors sitting next to each other, we would ask each other openly for each other's advice. It was a very unusual and, I've got to say, a bit endearing, shared community approach to health. My first big confusion occurred around my concerns about respecting Sharia law. Aceh is a Sharia law province, and I was familiar with the medical practice in the Middle East amongst Muslim women of male doctors kind of examining female abdomens from behind a curtain. So I got a little bit worried. Then, now to be honest, when I noticed this lady come in, I said to myself, please, in this crowded tent, may she not get into my line. But she did. And then when she approached me, I said to myself, please may she not have an abdominal problem. But she did. So I asked her, "Di mana sakitnya?" that is, where's the pain? And to my shock, she simply lifted up her dress and pointed to the exact point in her abdomen where the pain was. No one cared, least of all her. And I was relieved and smiled. We were very busy, but to be honest, sometimes I worried that it was all just a drop in the ocean. I knew there were 1 million people suffering, and so when I saw a patient, there were another 999,000, etc., needing care. But to be honest, I was encouraged by remembering an old Chinese phrase that I had heard in medical school, and it helped me ever since, and it helped me at that situation. Better to light a candle than to curse the darkness. Better to light a candle than to curse the darkness. And I will tell you about a young girl I treated who is an example of just such a candle. Her life and her entire future dramatically changed by our care. making it all worthwhile. Some boys visited us every day. They were sleeping rough near our tent and we fed them leftovers, sisa. Though actually they weren't leftovers because we intentionally cooked for them every morning and brought the extra food with us. Let me introduce you to Mo. Mo was one of the boys playing soccer, and like the other boys he swam, but it was very hard, and he told me he saw one of his friends get fatally speared by a sharp piece of wood shooting through the water and killing his friend as they swam desperately. He finally found a tree and clung to it, but when the water receded, he went home and found that his house destroyed and his entire family were gone, swept away by the wave. He never saw them again. He was living rough with another boy, also an orphan soccer player. It was gratifying to hear later how kids like this were being taken care of and no longer needed to live rough, eating handouts. These are deeply moving stories that affected me and the rest of the team greatly. I was also asked to see patients in the functional part of the hospital. Patients with pneumonia, for example. Severe pneumonia was common, so I went in with my most trusted instrument, my stethoscope, as a lung specialist. I saw a number of patients with pneumonia. I remember this child in particular with extensive pneumonia filling his entire left lung, and I held grave concerns for his survival. Sometimes the pneumonia the patients had was due to a new syndrome called tsunami lung. And let me remind you why aspirating tsunami water could cause severe pneumonia. The surging water is full of soil and debris and all manner of bugs picked up from the animal and bird droppings in the fields over which the waves rushed. So by the time they get to the lungs, they're full of awful bugs. And indeed, the hospital had run out of antibiotics 48 hours after the tsunami. And so that the antibiotics brought in by the aid teams were really critically useful for this sort of problem. I often had to care for kids, which is not something I do back at home, but their routine medical care was gone because of the number of community health services that had collapsed. So I saw them really for routine day-to-day GP type problems. In the hospital, I once saw a 12-year-old girl with a very unusual asthma and a very unusual history. She was definitely very wheezy when I examined her, but her asthma had only been present since the tsunami. It came on fairly suddenly. She had no aspirational infection. Then her mother told me what had happened. The mother had left her 12-year-old daughter in charge of the 8-year-old sister while she went to the local market. And when the tsunami hit, the 12-year-old held the hand of the 8-year-old. But as the water picked up speed, she lost her grip on her sister and screamed as her sister was sucked away by the water. They never found the little sister's body. And this 12-year-old girl had repeated asthma attacks since then, especially when it rained. Kapan hujan. We also provided mobile medical services to the more remote areas, seeing another 100 or 200 patients a day because, again, the destruction of the local kusmasses, which is the health centres. Personally, I found consulting in remote clinics to be tough. I had to often sit on the ground all day and do clinics. It's really painful because of some back injuries I have, and also exhausting, spending the entire day seeing over 100 patients speaking only a foreign language. I did have one surprising and encouraging moment doing this, not with a patient but with a team member, a young female Indonesian doctor sitting next to me when we had a break in the afternoon. She said to me, "Are you really a professor?" I said, "Yes." She said, "I'm surprised because you're sitting on the ground. That's very unusual for professors." I never thought about it twice, actually. It's sort of an Australian thing to do. But here's the thing, I realised that these young health workers were watching and learning how they could practice medicine into the future, watching mentors. Always saw a lot of kids, had a lot of fun with them, although this particular image is tinged with some sadness. What these kids didn't know was that the mother of 4 of them was in the building behind in prolonged arrested labour without access to any intervention, and thus was possibly going to die within hours. Anyway, the team went to great lengths to get some sort of alternative help for her, and I was told that she had survived okay. One of the advantages of learning the local languages is talking with the locals, sitting in the debris of their house, listening to their stories. I also trained local Indonesian doctors in medical intervention procedures using donated equipment. Now, we also had close engagements with the World Health Organization, plus UNICEF, Médecins Sans Frontières, UN and other agencies. They did a great job in very difficult circumstances. When you think about it, 1 million displaced survivors, all at risk of disease and starvation. 48 out of the 50 bridges along the main coastal road destroyed, so no easy access. Communication systems destroyed, most health services down. And then, to be honest, lots of foreign volunteer organisations needing to be coordinated through meetings. And many of these aid workers themselves had traumatic experiences of rescues, body bags, and some form of PTSD was not uncommon amongst them. Added to those challenges, there was, as if it wasn't enough, there was a separatist war going on in the province and the ongoing threats from the Bali bombing group. So I saw WHO in action and I was impressed. Our team also did livelihood assistance, that's rebuilding businesses, and shown here is an example of building fishing boats. One of the team leaders sorting out construction arrangements, and this is necessary because the tsunami destroyed over 14,000 fishing boats in Aceh, which is pretty much all of them. So there were hardly any left to feed the population. Now, who was this team that I was working with? Well, they are an Indonesian NGO called Obor Borkat, which loosely translated means tortured blessing. It's an established, award-winning NGO in Indonesia that usually provides public health, education and other regular services, but because Indonesia is disaster-prone, very disaster-prone, they also create disaster relief teams like this one when needed, and I've worked with them actually many times now. They were a young team of around 120 with me the only foreigner, big tall white guy. They had doctors, nurses, pharmacists, mosquito controllers, public health people, all sorts of people. And they were working at the coalface of the worst of the situations in post-tsunami Aceh. And it was a treat and an honour to work with them. And I'll tell you one thing I noticed, they never complained. There's something else which surprised me. This organisation, which was working closely with the Muslims in the Sharia law province of Aceh, is Christian. I didn't know that. And they also told me that 10% of the Indonesian population are Christian. I didn't know that either. It was a good example of different faiths working and living together to help people in need. Now, the team were initially reticent to talk to the patients about their disaster experiences and how it affected their families. It kind of felt a bit like a voyeuristic invasion of privacy. But we then had a meeting after we realised that we were not really helping them in an area where they needed help, which was empathy. They needed someone to talk to, but because all their friends had also lost someone close, there was always a risk of a grief comparison, if you like. Well, you lost a brother, but I lost both of my kids, sort of thing. So they needed someone from the outside. So we began being more intentional about this, despite, to be honest, the emotional cost to us in doing so. Which brings me back to listening to a school teacher that I'd mentioned in an earlier video, where he had been driving with his wife and daughters when the water started and he didn't know what to do. One of our team members, Mark, was travelling with this guy in a vehicle. He was driving, being driven by the teacher, and when the car stopped for some reason, Mark gently asked him about his family. But there was silence, and when Mark looked over at the teacher, tears were running down his eyes. Tears were running down his cheeks as it all came back to him. And he said that he didn't know what to do. He told his wife and daughter to get out and run, and he would stay with the car, thinking they could outrun the water. His wife and daughters were never seen again. Drowned and washed out to sea. His deep grief being compounded by survivor guilt. I mean, there's a price for choosing empathy. It's very noble, but it can get pretty intense in these situations. And one evening, I remember, coming back to where I was staying, I shut the door behind me and I just sobbed. sobbed and sobbed for the sadness these people were bearing and carrying. It was hard, but honestly, I felt privileged caring for these people. Now, because most of the bridges in Aceh were destroyed, particularly along the coast, trying to get to the remote towns, we had to get there by chopper or fixed wing aircraft, and we headed up to a place called Lockrute by helicopter. And the first thing I noticed when I went up there was that not a single house in the town was left standing. The helipad itself was just a devastated house with a strong concrete floor. They pushed all the debris off and used the remaining concrete floor to land the helicopter. On a subsequent visit, I flew by fixed-wing aircraft, which was trickier flying. The pilot had to fly low over the remaining stretch of road to check it was okay, plus scare off any animals. Then he flew around and flew over the trees, clipping a few of the trees at the top, and then landed. I was always in the co-pilot seat because of my size, and those trips were honestly like Disneyland rides. Most of the people in this town, Lockrute, were killed by the tsunami and their bodies washed out to sea. So to put it bluntly, it was not quite as busy as it was back in Malabo. You can see the setup here. We have a pharmacy in a tent, we have a desk, sleeping next to the desk on the camp stretcher. The dentist, Eureka, working next to me, which was kind of convenient because I could ask her Indonesian words without her having to even turn her head around. There was an Indonesian army base nearby. That's because the front line of the separatist war was only kilometres away. The soldiers came down to us for treatment and, to be honest, maybe to chat to the girls, I suspect. They always appeared relaxed, but when I decided to go for a bit of a stroll one dark night, a soldier on duty got very angry and asked me where I was going. And I told him I was just going for a walk, and he said, "No, you are not." Sent me straight back to the tents that he was guarding. So it was quite tense for them, I think. It was terribly hot up there in Lockrute, so I decided to go swimming. A bit tricky with the sharp coral and the waves, but not too bad. But I felt really weird when I was swimming because I had to swim fully clothed to respect the Muslim traditions in this Sharia law place. I had no problem with that. But mostly I felt weird because underneath where I was swimming were the remains of the school that the kids had been attending. It was kind of spooky. The wave comes in, and then as it gets sucked out, it sucks out part of the coastline. And I thought about their little bodies being washed out to sea, and yes, it was tricky, weird. Anyway, on the Muslim holiday, we shut the clinic, of course, and then we went down by fishing boat down the coast to another location, Ujung Rimba, and helped some friends down there. This is the 5th type of transport I had experienced on that trip. Now, I do get asked sometimes, was it dangerous? There were a few dangers. You can see it on the list. But to be totally honest, the greatest risk we faced every day was the speed of the young drivers driving us around through the debris and chaos and traffic. They were confident young men who drove fast and well, but they dodged animals and passed other cars dangerously, and I just relaxed into it. I learnt a lot from our beautiful team, some of whom are seen here at a local beach, taking a brief mental health break, ironically, amongst the waves. A number of the team members are still friends. The team closeness, including investing in downtimes, helped everyone cope. These times, team times also created opportunities for one-on-one discussions with other team members. For example, this is Dr. Carla, whom I mentioned in the first video. She was one of the first doctors to get into Aceh to help, and she heroically and tirelessly looked after patients day and night in a local shed, I think it was, that was still standing. So I walked along the beach with her, represented in this image, and talked to her about what it was like to go to bed each night, knowing that there were thousands and thousands of people who still needed her help. And she started to weep. And she said it was the first time she had cried since the tsunami. I realised I needed to save up some energy and empathy for team members as well as for the patients, and others did too. Anyway, I hope you found this short description of some of the medical aid we provided to be informative despite the hardships experienced on my 5 visits to Aceh. And I'm so grateful for those experiences. They really softened my heart. And as I've said earlier, and will repeat now, the purpose of these videos is to inform and encourage others to volunteer in such situations, in any disaster situation, and maybe even in just normal volunteering. It's obviously especially applicable to health professionals who can help, but also, as I've mentioned before, all parents and grandparents to inspire their kids and grandkids, anyone whose life has become a bit bland and boring, and tourists who can add a week of community service to their overseas holidays. And in my third and final video, I'll discuss how to go about this type of volunteering, what's important about it, why is it so good, how can you do that from disasters to the community-based activities, and there's a link provided on how you can go about that in, I think, 25 or 30 different countries, the organisations and the websites and how you can go about that.